Hey everyone, thanks for tuning in and welcome to Quick Tips. Steven here with Team Euphoric, and this week we're going to be going over 3 exercises to help decrease your low back, hip, and knee pain and improve your posture. A lot of low back, hip, and knee pain is going to stem from some type of dysfunction in the lumbopelvifemoral complex, and one common postural fault is going to be excessive anteversion of the pelvis or an anterior pelvic tilt. So one of the things that we can do to help with that is going to be strengthening the lower abdominals. Your rectus abdominis, or your superficial six-pack abdominal muscles, it is going to attach to the pubic symphysis. So as this muscle gets stronger and contracts, what's going to happen is it's going to pull the pubic symphysis up toward the sky, and it's going to bring the pelvis into more of a retroverted pelvis or a posterior pelvic tilt. And the way that we can strengthen the lower abdominals is we are going to go ahead and lay down on our back. And with the arms, we want to go ahead and we're going to place the arms at the level of the glenohumeral angle. If you're not sure where that is, it's roughly when your palms are at the level of your forehead. Then from this position right over here, what we want to do is we are going to flex the hips and knees to 90 degrees. And we want to try and get our back nice and flat on the ground. And then for the actual execution of the exercise itself, what we want to do is we are going to drive the knees up toward the sky. So we are going to try and flex the lumbar spine. And that is the actual execution of the exercise itself. It is a very, very small movement. The first time that you do this exercise, you may not even be able to lift your butt off the ground. But what you would want to do is just push as hard as you can. So if all you can do is an isometric contraction and you can't lift, just do that. And then eventually you should be able to lift your legs up toward the sky, up to the level of the umbilicus. You don't want to go any higher than that. Once you go higher than that, then you're no longer really going to be recruiting mostly the lower abdominals. But a couple of common mistakes. Mistake number one is when you are bringing the legs up toward the sky, you don't want to go into flexion of the hip and bring the knees toward the stomach. If we want to try and isolate the lower abdominals as best as possible, we want to make sure that the knees are just going straight up. So imagine that if I were to have my hand right in front of your thighs, you shouldn't be making contact with my hand. You should just be going straight up toward the sky. But that is the strengthening exercise for the lower abdominals. And then in a couple days, I'm going to be taking you through another strengthening exercise to help correct the pelvic dysfunction. And that is going to be the strengthening exercise for the gluteus maximus muscle.